Good evening, everyone. Today's Organon class given in the Organon by Master Henneman. So, by the time the other doctors are going to join, let me just give you a quick uh, review what we discussed in the last class. In the last class, we talked on the introduction of Dr. James Cross. So, that we discussed how he was able to portray Henneman in the whole history of medicine, and he could really give the right place in the history of medicine to Dr. Henneman. And he told us that how Henneman was scientific, the only scientific person of that time, Dr. Henneman, and I added my view on this that can you understand that in some 2 centuries back we were extremely scientific, but then after this many years we are lagging behind. So whatever it may be, our footings are very strong. We should go ahead. And reading this Organon, my discussion on Organon with all of you, it is just an endeavor to really going ahead with this viewpoint that once all the students, doctors, scholars, researchers of homeopathy, they must have this grasp of the book. Once they are having this grip in their hand, research only requires a orientation because we have been keeping us away from the research. So when you are keeping away from something, it becomes sometimes very difficult for us that what is this trial, what is this observational study, and so many different terminologies come, so that we can be familiar with in a short time, not an issue. But the crux of the matter is that he made us understand, Dr. James Cross, that Henneman and his book Organon of Medicine, as I told you in the yesterday's class, I just read one line of the introduction, last line of the introduction by James Cross. Henneman's Organon of Medicine diagnosis as the H.A. Helwig of scientific medicine. He is saying the Henneman has given this book, and in this, what it contains one very mm, experimental basis how the symptom similarity of the disease and symptom similarity of the medicine, when you apply, the cure comes. This is the main basis. This is the main premise, and this premise in the medicine is one such thing which is like a real holy fight of scientific medicine. This is the real fighter. This particular premise is the real fighter, as given in the Organon, and this is why James Cross told us to really talk on this, pass it on, do it, learn it. So we are learning, we are trying to follow James Cross in much better way. So let's go further, and today we are going to discuss and understand about the table of contents. See, this is the table of contents. I'm just showing you. You open your book, you know this. I'm just simply showing you. So we are going to learn about the contents. You all will be winking and laughing on me that do anybody read content of the book also? Do anybody discuss about the content of the book? But then I understand if you really want to understand Hahnemann, we sentence we must try to understand very seriously. So presently, what we are going, we are going in a very very stepwise manner. That how the anatomy of the book. Then in the anatomy, we are going step by step. We read all the prefaces. Then we read, the introduction of James Cross. Then now we are going to understand the contents of the book. So you understand what is contents of the book. We all have been reading since our school time, and we are completing our college, or we have completed our college, and we know each book has a content, it has a purpose. See, Organon, this is something very very important to understand this content table. First of all, I tell you, if we go in the history, uh, this content, who has utilized, you know who has made this table of contents first time in the history of medicine. So if you go into the history of medicine, how will you come to know? you know there was a Latin poet who was a grammarian also, means he was a teacher of grammar also, and belongs to Roman Republic. The name was Quintus Valerius Soranus. I repeat, the name of this poet and grammarian of Roman Republic was Quintus Valerius Soranus. He was in 140 to 130 BC. This time around means almost the declining years of the BC. In those days, this poet of Latin language and so many things he was doing, and when he wrote his books, he was the first one to write down the table of contents. So this is what we get in the history. Now, why means, if suppose you are writing a small book, and in a small book if you are writing, and if you give table of content, may not be that useful to all of us. But then if suppose the book is like a ocean, it is like a big ocean. Why we need a teacher, we need some lectures, we need all these things for this book? Because this is not a small book. It looks like a very thin and some 200-300 pages book, such a book. And if you are going in the ocean, what you need a navigator. What you need a navigator. Suppose you, if you just see in the history, the most courageous sport was the voyage, going in the sea, finding new places. That was the most courageous sport of those days of ancient time, because you are going in the sea, and you were not having those days any compass or any such kind of tools. So while going in the sea, they developed their own science, which became, the navigator for them. Like, for example, the most important navigator, the helper for voyage, were the stars. They were able one, which is the lesser brilliant one, which comes first as the evening comes, which goes last as the morning starts coming up. So like this, the best navigator those days was, the stars. So book like Organon of Medicine, which is like oceans, until and otherwise you have a navigator, you just can't sail into the ocean, this book, ocean like book. So this content, this table of contents are nothing, it is just nothing. It is a navigator of the book. Mind this, navigator, contents of the Organon of Medicine is a navigator. See, it is a very sad scenario about the medical art, it has to face a lot of unscientificity. As James Cross told yesterday, Dr. Hahnemann was the first true scientist came in the medical art, and he gave his concept, his thesis in the form of organon of medicine. So the need is that we must first feel that for like some 3,000 years, the human race was groping in the dark, looking for some kind of navigator to go around in the sea, in the ocean of diseases. When a patient comes to us, he is a ocean of symptoms, but then we need some navigator how to understand the ocean of symptoms in one patient. Until and otherwise we have a navigator, we can't really go ahead into the understanding of the patient. This is where the difficulty is. And if you really keep in mind, end up with another ocean of symptoms, a changed ocean, a changed sea. It is now different kind of sea coming to us. But then in this kind of ocean, where you find lot many symptoms of varieties and different kind of presentations and different kind of words, then a physician is in trouble how to go about, how to navigate in this sea. So all of you, please keep in your mind this contents table is really going to guide you where to go and see, where to get the guidance. For example, let us see a few of the more things of this contents table. First of all, the whole contents of this table, then it has got some 372 lines. If you count very seriously, it is having 372 lines. And it is not like para, so I have not made it para wise. I made it only page wise and the line wise. So we understood so far of table of contents having some 372 lines. And basically if you see, it has got, as we discussed in the anatomy of the book, it is now reflecting in the similar way. The anatomy of the book is very much reflected in the table of contents. Like it is showing about the introduction of Hahnemann to the organon of medicine. Then in the introduction part, which is around some 30 pages, and in this odd 30 pages, you find a very even three kind of points to understand. First, you are going to get a review of the kind of treatment. Only you are able to make out what is really important to do, what is really necessary. Hindi words are very helpful to explain. All right, I'm trying to be bilingual, and मैं बार बार आपको सबको यही बताना चाह रहा हूँ कि हम कंटेंट्स की जो टेबल की बात कर रहे हैं, कंटेंट्स के टेबल को हम एक किस्म का कंपास कह रहे हैं, किस्म का नेविगेटर कह रहे हैं, जिसके थ्रू हम इस किताब के अंदर जाके कहाँ पे क्या देखना चाहिए, किस तरह से कौन से एरिया में कौन सी टाइप की बात हम समझ सकते हैं। वो बिल्कुल ऐसे ही जैसे मैंने एनाटॉमी ऑफ द ऑर्गेनॉन बुक बताया था आपको, ये पूरा का पूरा यहाँ पर रिफ्लेक्ट हो रहा है इसके अंदर। इसी तरह से ये टेक्स्ट बहुत लंबा चलता है और उसके बाद में डायरेक्टली एक बात आ जाती है जिसको हम अपेंडिक्स कहते हैं। आप लोग नोट कर सकते हैं कि अपेंडिक्स जो है ये एरिया बाद में कंटेंट्स में जोड़ा गया है, क्योंकि ऑर्गेनोनिक्स में क्या दिया हुआ है। अपेंडिक्स में हमें, जैसे मैंने बताया था, एक पूरा इवोल्यूशन मिलता है ऑर्गेनॉन का डेवलपमेंट फ्रॉम दी से कैसे इसका एक एक अफोरिज्म का एक इवोल्यूशनरी डिटेल्स इसके अंदर हमको मिलता है। इवन ए वर्ड इफ चेंज्ड, इट इज बीन नोटेड हियर बाय Dr. Richard Hughes. Very, very meticulous, very, very strict things about. One is review. The next is the knowledge and the practice of homeopathy in non-medical people. The law of similia is not something which is given, and he never claimed. He wanted to discover this. This itself is a very very great deal. बहुत बहुत बड़ा काम है कि आपकी आंख के नीचे क्या हो रहा है और साल में किसने तो देखा नहीं, डॉक्टर हैनिमन ने ही देखा कि भाई जो भी नॉन मेडिकल लोग भी हैं, जो किस तरह का भी नुस्खा इस्तेमाल कर रहे हैं, डॉक्टर हैनिमन एंड प्रैक्टिस्ड एंड वांट्स अस टू बी प्रैक्टिसिंग। तो वो हमको वहां पर नॉन मेडिकल पर्संस का मिलता है एक unconscious can be the most important law to cure, where the excellent physicians of those days felt and expressed that there is something to be called law of similia for the purpose of cure। नहीं हो रहा है, जो लॉ ऑफ सिमिलिया नहीं हो रहा है तो क्या हो रहा है उसका पूरा रिव्यू, वो किस तरह का अनकॉन्शियस होम्योपैथी। और उस जमाने टू टेप इंट्रोडक्शन नेक्स्ट वी विल बी गोइंग इनटू द each and every detail of these 3 points। Then coming to the text of the Organon. See, in this text of the Organon, you will some 1, 2. What is given in the aphorism 3, 4? Again, some internet. If I just stop it here for a minute, we can be in some couple of minutes. This buffering may become all right. You can tell me because the important point should not be missed in this buffering. So I'm just holding on. So many, everyone saying good evening. Then let me just review about what is content and who used the table of contents first time in the navigator of the book, especially for those books which are like Oshin. Like for example, if you're referring a book which is encyclopedia, so finding out something in the encyclopedia, you really need some table of contents. Until otherwise, it is in the format of alphabetical order, written on the experience of doctor, and many experiences of other doctors are also added in it, as a reference. So for that, we really need to understand that how to go and where to refer in this book. That is why, the table. I think I just stop it here. Achha.